The following is an Operation Podcast production.
This is Dr. John Howe. I'm the medical director for Stella. Welcome to Ever Forward Radio.
I've heard you talk about one of the treatments that we're going to get into as, quote, vacation in a syringe. And before we actually get into what that is, there's some pretty wild stats going on right now in the world, but definitely America, with the state of mental health. And I found a recent 2023 poll showed about 50% of 48.9% of Americans aged 18 to 29 are reporting symptoms of depression and or anxiety. So before we get into these treatments and different modalities, what is maybe your, quote, state of the union on mental health in America? If you could address the powers that be, say this is what I view as going on as the mental health state of America, what would that be?
Well, it's an extremely exciting time. You know, there's a lot of tools that are out there that are becoming more well-known. And we as a population and as care providers are trying to figure out how to use those tools in the most effective way. Some of it is the mental health professionals are in some ways being led by the people that are not mental health professionals or have, experience outside of what is traditionally thought of as mental health. And that has to do with the fact that there are legal challenges for different substances in this country specifically. You mentioned that like half the people are depressed or anxious. Is that because they're just realizing that now? Is that because they always were and didn't know what it was, and now it's become it's been okay to say it? I don't know. But I think what it speaks to is that there's a lot of people that feel as though they're not right in some way, and they want to find a way to be better. And there is this movement, you've heard this psychedelic renaissance as something that's been talked about. And I think that's true. There definitely is, or there was in the not so distant past, this big excitement about what the psychedelics can do. Things kind of got squashed, in the Nixon administration and then Tim Leary.
The war on drugs and now the crushing of MDMA therapy. Yeah,
I mean, there's always going to be this interplay between what is acceptable, what is legal, what is paid for. That's by insurance companies, et cetera. And we're not talking about that specifically, but it's part of the milieu of this. And where we're going to end up, I'm not sure. But I am excited about where it's going to be. Is it that we find that these different molecules, talking about any other psychedelics or sedative hypnotics, which is ketamine, how do we use those in conjunction with the therapy modalities that we have out there, and with the Stellate Ganglion Block and with TMS and whatever that happens to be? Where we're going to end up, I'm not sure, but I know it's going to be a better place than we are now. You look at the effects or the efficacy of SSRIs, the standard things that's given for being depressed, and it sucks. Like they're not good medicines.
Especially when you try to get off of them.
Yeah, then that's another part of it, right? So then you have you have side effects that aren't great. You don't feel like you're getting a benefit from it. You're just maybe not so sad, but you're not so happy either. No one really wants to feel like they're a blunted version of themselves. Not to say that everybody does. There's plenty of people that have some benefit from SSRIs. But I guess where I'm going with this is that to figure out how to combine the things that traditionally have been serving us from a mental health standpoint with the newer modalities. I don't think psilocybin is new, you know what I mean? No. But like with the other modalities that are becoming more available to the population, whether it's traveling to Costa Rica and getting ayahuasca or whatever that is, to find a way forward and through that and be able to tailor the treatments that are available to any one specific person, that's what's exciting to me.
Yeah.
And I'm not just saying this as a provider, like hey Chase, I'm going to figure out what we're going to do for you. No, it's got to be a conversation, because there's things that are happening in your head that I can't get to. You know what I mean? And tomorrow's going to be different. So what's the right answer? You've had experience with some of the treatments already. We talked about that briefly. Like to use ketamine specifically, how often are we doing the redosing? When do you need that? Why do you need that? Is it what are the metrics that we're looking at? How do you know that you're ready for another one or not? And is it because you had a challenging thing that happened to you in your life yesterday or 3 weeks ago? Or is it that there's something wrong with your brain chemistry? Wrong is a bad word, you know what I mean? But like that's the interplay of having people that are educated, that can be advocates for themselves, that understand what's available and how to plug that into them, but then also having care providers that are savvy and open to the different modalities that are out there. And no one understands everything about everything, but trying to be curious about it and stay curious about it, that's important to find the mix of those two things. Now, I'm not there yet. I'm not the guy that knows everything about everything. I'm good at what I do, and I'm excellent about providing that. And I can have conversations with other providers and patients about how what I provide dovetails in with what they're doing. I think that's going to be the state of the union, as you say, for a long time. Because is it that psilocybin is decriminalized or available? And I just keep referencing that because most people understand that. But there's ibogaine, there's ayahuasca, there's all these other molecules. And then the modalities that are currently available, whether it's CBT or EMDR or whatever the type of therapy that is available, figuring out the mix. We all just need to know that we don't quite know what the right answer is. And every answer for every person is going to be different. It's a journey. It's fun to be on it. It's exciting to be on it. It's an honor to be part of it. And as a patient, it also gives me hope for what's ahead.
Yeah. I'm especially, I think, when we're looking at treating mental health, or first understanding, diagnosing, treating, and developing lifelong plans around mental health, you have to have hope. And I think that's where I definitely want to get into that later. Hope is such an important part of mental health treatment, and is where, speaking from experience, where people kind of completely give up or seek answers out of desperation because you have it or you're looking for it.
Yeah.
Not just treatment, not just answers, but hope. Before you can even feel better, again, speaking from experience, getting to a place where you can have hope that you can get better when especially it's been gone is paramount. Like that in and of itself, I think, gets you over the hump of poor mental health, even things like PTSD, depression, and anxiety. I wonder right now, do you feel, because so many of these things are more top of mind, we're seeing it more on the news and social media, things like psilocybin, MDMA, different modalities like stellate ganglion block, ketamine therapy. Are we now in a place culturally where it is more acceptable and the science has always been there, or has the science just now gotten to a point and, culturally we're playing catch up? Do the two can they work independent of each other basically, or do they need to be present both?
It depends on you, where you live and what you're dealing with, I think, right? So there are certain countries or regions where modalities are available and certain areas where they're not. And there's also different areas where it's acceptable, whatever that means, to the person, to the medical community, if you're asking that group of people's opinion, and to the government, what's appropriate and what's acceptable. So it's there's going to be variability across the country and around the world as far as what's available and what people reach for. I'm not sure if I'm answering your question.
Yeah, I definitely understand what you're saying. Let's maybe for this purpose of this podcast, let's keep it focus on America.
Great.
So let's say, do you think culturally in America, we are in a place where the science has an opportunity to actually shine through and get some stickiness for these modalities, or it's more one than the other, and we're not quite caught up with both yet? And do we need both to be present here in America to actually stick?
It's always going to be a progression, and there are parts of what we can offer that can advance. There are plenty of things that are available. We're here to talk about stellate ganglion blocks and ketamine. Those are available. Therapy, that's available. TMS, that's available. There's different things that are out there. So is the science advancing? Yes. Is treatment advancing? Yes. Are we in a good place where the milieu of what's acceptable and the state of the science and state of the art is advancing? We are. Would it be nice to have more? Sure. But yes, we're moving forward.
I like it. Moving forward. We're on the right podcast for that. Your work focuses on, quote, treating mental health challenges as injuries, not disorders, which I thought was a really interesting, for lack of a better term here, tagline. is this implying then that we have been treating mental health conditions all wrong? And what does treating it like an injury versus disorder really look like in terms of both care plan and success rates?
Yeah, I think what you're talking about specifically is PTSD, post-traumatic stress disorder, and there's a movement across diagnostic manuals in general of trying to remove the word disorder from a lot of things, because specifically with PTSD, usually something happens, right? That's challenging, that puts you on your heels, and then that brings about a change in the way that your body, mind accept the world and interact with it. So that's the injury thing. Depression can come along, anxiety can come along. Those aren't necessarily injuries, although they're usually related to it or can be related to it. But yeah, so there's a thought that maybe a more appropriate term for PTSD would be PTSI, so post-traumatic stress injury. But that's what that specific thing is talking about.
Okay. So we've been hinting at it. Let's dive into what is a very new procedure and treatment for PTSD, depression, anxiety, amongst other things I'm sure we'll get into. And that's the Stellate Ganglion Block. And if someone Googles this real quick, they're going to see, again, what could be considered a pretty radical procedure, quick, but we're talking injecting something, going in, messing around with nerves in your neck to treat mental health. What is this Stellate Ganglion Block? Walk us through the procedure, and how can someone really get on board with something like this when it sounds so invasive?
Sure. Well, first of all, this is something that's been around for 100 years. We've used it for all sorts of different conditions.
This procedure?
Correct. It's used for chronic pain. It's used for something called Raynaud's phenomenon. It's used for heart arrhythmias that aren't treatable with other modalities. It was used initially by doing it blind. The doctors would find landmarks and do different things with needles to try to get it where it's supposed to go.
Just hoping we're poking and prodding in the neck, we get the right spot.
There's some finger crossing, definitely.
I mean, I'm sure that's a lot of original medicine, right? But
yeah, so it's been around forever. But the first paper that showed that it helps with mental health concerns came out in 2006. So that's kind of the newness of it. The way we do it now most safely is with ultrasound, because then I can see all the structures in the area and make sure that I can avoid the things I need to and get to where I need to go. I can also watch the medicine.
That's nice.
See if it spreads in the right direction. So yeah, it is, to be succinct about it, it's an injection of a local anesthetic next to the nerves in the neck that are part of the sympathetic chain. So your sympathetic chain is the body's part of the fight or flight response. The brain has an analogous structure called the amygdala, and the communication between the amygdala and the sympathetic chain is where you get your sympathetic tone or how much you respond to any one situation.
Okay.
So I'm using a medicine very much like what the dentist uses to numb up your tooth, but instead of putting it next to a sensory nerve like the dentist, I'm putting it next to these sympathetic nerves that carry different information. The numbing of those nerves, it lasts for about 6 hours or so, the actual numbing, causes a reset of the emotional set point. Or to say it another way, makes it so your fight or flight response is downregulated or brought back to where it should be.
So is that stating, or can one assume that a traumatic event or a poor mental health condition is nothing more than a breakdown in communication of nerves between nervous systems?
Or an over communication, may be the way to say it.
Okay.
Yeah. So if your body and your mind interpret the world to be a scary place for whatever reason, they're going to upregulate your wariness, right? You're going to be on edge. It's going to be hard to focus. You're going to have sleep disturbance. You're going to be irritable. Those are the symptoms or common symptoms that we see with PTSD, because the body is ready for some sort of insult.
Hypervigilance.
It serves people that are in the military. It serves people that are in high, in environments that are like that, because it keeps them alive. But when you're no longer in that situation, it can be detrimental to your mental health and your ability to interact with the world. If everything is out to get you, it's hard to sit there and be cool with your kid and have a conversation with your wife.
Yeah, if you're a hammer, everything's a nail, right?
Yeah.
It immediately makes me think of a lot of different ways, ways to use this. I'm a veteran myself, and so coming from the military background, I could see an amazing advantage to, I don't know if this is accurate, but having a procedure like this, like in the opposite, have it turned on to where I am in just my sympathetic and parasympathetic nervous system are exactly where they need to be. I can just, kind of override my system to be even more hypervigilant. It's almost like a performance enhancing drug or, a biohack for someone that needs to be hypervigilant. And then can you go the other direction of like, okay, I'm off duty or my tour's over or I'm out of that situation. I can like turn it off. Are we talking about just like simply a on and off mechanism here?
Not necessarily. I mean, this is part of, in some of the special forces circles, they would do this between deployments, or they still do.
No way, really?
Yeah, because
that's exactly what I'm getting at. Yeah.
So they would, and then, the question always comes up, or often comes up: if I get this block, is it going to block me? Is it going to make it so I can't respond? And the the reason it's called a block is just historical. When I'm doing a nerve block, it means I'm putting the medicine next to the nerve to turn off the nerve. But conceptually, what this does is it unblocks a person. So you still have access to the entire range of your responses. It's just that you're not stuck in the over response. You have the choice to react or act instead of just reacting all the time.
So it kind of gives us more of that driver's seat position of, do I need to be sympathetic or parasympathetic instead of my body dictating based on the situation? Like I no longer need to wait on my body to get on board with the situation. I can just go, this is what I need. Yeah. And I can choose to kind of all systems go.
Yeah.
Wow.
It gives you the space to choose how to react instead of having your body just do this thing that is or has been protective in the past, but doesn't necessarily serve you now.
So then is there a particular type of traumatic life event that you have seen people have a higher positive response to with this modality? Or is it just, any situation that, one could find themselves in where it is that like hard on or hard off?
Yeah, no, there's not like a type of trauma that this works best for. It could be people that have had, some sort of traumatic event in their childhood and that's what it was, or someone like yourself who has military service, or someone like me who's an ER doc and gets the vicarious trauma every day. Like it can be a big capital T trauma or a bunch of little lowercase t traumas that happen all the time. And then the other thing is, once you get it, just because you get the block, it doesn't protect you from future trauma. I always tell people, if you get sued or divorced or something weird happens to you, life's tough. Come on back, because this won't help from what's to come, but it'll help with what has come before. It also puts you in a better position to receive challenging life events that are coming.
Why do you think that is? Is there a systemic answer here, or a clinical answer as to why this procedure we can block and the past does not show up the way that it used to? But let's say, even if is it the same situation, or could be the exact, maybe different situation, but same physiological response to like we did in the past, but why does it differ? What's different about the past in this procedure versus the future in this procedure, if it is just a matter of turning something on or off physiologically?
I see what you're saying. The bad analogy is, once a cucumber becomes a pickle, it's always a pickle. Like you're always a little susceptible, the things that are challenging to you. If you've had something that has resulted in PTSD like symptoms, or the frank PTSD, then you're more likely to pick that up. There's actually some thought that there's genetic connection between people that are more susceptible to getting PTSD because of their genetic makeup, and that's a conversation for another time. But if that's the case, then let's just use an example, a person that has had childhood trauma and they have been spun up for their entire life, and I do this block on them, and now they're in a safe place and they're fine, and then they get divorced, which is hugely traumatic for people. Then they could get very similar symptoms, because the body just knows, are we in danger or not? It's the kid thing or it's the divorce thing. It feels the same. And the pathway in the body is the same. The thing that is thought to be protective, thought to be anthropomorphic, that your body does this thing to protect itself and becomes dysfunctional, is the same thing every time. So I've helped you with what came before, and then something else happened that caused you to have a worsening of your symptoms. I can help you again. There's some people that come in, myself included, I do this every year, every 18 months.
You?
Yeah, I get it. Can't do it on myself, but I get it.
Now, is that because you find personal value in kind of every 12, 18 months, you said, just making sure you're staying on, let me rephrase that. I think it would be safe to assume every 18 months, you said, most people's lives are going to get significantly more stressful, or you're going to experience new stressors. So is it just kind of like a maintenance thing for the type of life and work that you do that just keeps you ahead of that stress curve, so to speak? Or is it just have like a shelf life kind of thing?
It depends on the person, but yeah, in my case, things happen. It's my life is great, but it's not great too. You know what I mean? And so and I know that I can do this thing to make me feel better if these symptoms are showing up. It's like, this doesn't apply to me, but if when you need a haircut, right? It's like you go in because you know that the barber can make your hair shorter. I'm like, these are a problem for me. These are affecting how I'm acting or how I'm reacting. And I know this thing can fix it. So I go in and did it.
So then walk us through this kind of actual experiential part. So I go in, and this is actually transparently something I'm considering getting done, a procedure I'm considering getting done for ongoing anxiety, depression related to PTSD. What am I going to experience? Is it just, I go in, you do what you just mentioned. What comes next? What do I feel? Is it just like an automatic on-off switch and I'm just in euphoria? Or is it now I'm just in a different physiological state and therefore, quote, the work is going to be a little bit different or better? Do I need this coupled with integration with other mental health therapy modalities people maybe are more used to? Yeah. What comes next? How does it work after that?
Yeah, it's a great question. Like all the things that we've talked about, this is a tool in the toolbox. It's a treatment that is transformative for a lot of people, but to do it by itself is probably not the highest and best way to get the best out of this, right?
Okay.
So to answer your first question, what does it feel like? It ranges from a few minutes after I do the injection, you will feel peace. You will feel as though you can breathe deeply. 35% of people have a very strong emotional reaction. Usually it's tears. Sometimes it's anger. Sometimes it's a mixture of anger and sadness and happiness. It's very odd. It comes out of nowhere. So I warn people before they get on the table that this might happen to you. If it does, just lean into it because it's part of it.
Is it kind of like, have you ever done a breathwork session? Mm-hmm. Is it kind of like that, just out of nowhere, you're just breathing heavily, crying, and just feel this kind of like cathartic release, inexplicable release? Yep. Okay.
But you're not working for it like breath work. You're just laying there talking to me about how you're feeling, and all of a sudden you're just like in the tears or in the feels or whatever it is. You just don't know what it is. Now, usually it's just a general feeling of the emotion. I have had people that I had one guy that was a POW and he was like verbally processing battle buddies, which was pretty heavy.
What do you mean? Just like
talking about the people that had been with him in the POW camps and like like that almost never happens.
Kind of like in a PTSD scenario where he was like did he actually think he was talking to them or
no? He was talking to the people in the room. He wasn't dissociated, but he was talking about them and talking about feelings that he was having, survivor guilt and things like that in a very, very impactful way. That almost never happened. I've done like 2,000 of these procedures and I've only seen that happen one time. Most of the time it's just, I'm sad and I don't know why. And it's just, the waterworks go and it's 15 minutes, you're done with that and feeling better.
Why? Sorry to interrupt you here, but this is it's fascinating. Like, do we have a reason why? Like, why does that happen? Is that the secret? Is that the secret place and method to unlock? I mean, it's called the ganglion block. So are we unblocking? Is this actually the place where trauma and sadness and depression and just unprocessed memories and feelings like literally physically get stuck?
I don't think that's where they get stuck, but that's kind of the place where we know that we can unlock it and start the reprocessing. It's really bizarre and then sometimes what can happen, as you likely know, like emotions can be stored in the body. So people will start shivering sometimes. They're not cold. It's just their muscles start releasing things. Or if you've got this knot that's been here for 10 years or whatever, that will sometimes start going because there's emotions stored in that. Like if anyone's had acupuncture or massage or worked in that field, it's not uncommon for people to have just these spontaneous emotional releases when you're getting body work done. So very similar to that, but it kind of is the master switch to that and everything can start releasing. And that can last for a day sometimes.
So I go in, I get this procedure done. Potentially moments after, I could be experiencing just this unexplicable emotional release, this kind of, this dumping of blocked emotions and bad memories, so to speak. And then is it, okay, all of a sudden I'm better, or is it I need to now work through all of this, kind of like in traditional talk therapy? Like, I don't know where this memory kind of came, so now I need to navigate through it, or is it just, oh, it's out and I'm good?
It's not a memory. It's an emotion. Like you're not processing a specific thing. Like I said, one time that's happened, But the times as a patient that I've had this, I'm not thinking about things that make me sad. I'm just feeling sad.
I see.
And it lasts for as long as it takes you to process it. And you know, and again, this doesn't happen to everybody, but this can happen. It's 10 minutes and then you feel tired and relaxed. Now, let's take that piece out of it. Let's say you don't have that response where you have this very strong emotional response. The most common description is, I can breathe deeply now and I couldn't before. I feel like there's a weight lifted off my chest. I feel peaceful. Or I feel like the monkey mind is not talking to me, which is very strange for some people. They're like, I don't know what that means. Like there should be a thing going on in my head and it's not, which makes them very present and very, that feels good.
Yeah.
Strange to a lot of people, but good.
Have you found that with particularly this procedure, the stellate ganglion block, this relief, these kind of next steps that come after the procedure, are they more typical for someone that comes after doing, quote, the work of, I've tried a bunch of other things. I've journaled, I've meditated, breath work, talk therapy, and I have more kind of top of mind things or a thing that I'm ready to release versus just someone who has maybe more, whether this is consciously or subconsciously they're admitting it or not, no reason why. I don't know why I'm depressed. I don't know why I have anxiety. It doesn't matter the readiness or the thing that you come ready with or not for this procedure to get this benefit.
I think if you have done work before and you have a team around you already, you're going to have a better long-term outcome. Physiologically, what I'm doing by blocking this nerve is turning off the norepinephrine, which is the neurotransmitter that is part of your fight or flight. So I put the medicine in there and that turns off, and it doesn't matter what you've done before or afterward, that feels good. That's the first thing that happens, and that happens on the table. The norepinephrine in the sympathetic chain stops. Over the course of about a week, the number of connections between the amygdala and the sympathetic chain decreases. And this is kind of to go to what's the next thing, what's the range of things that can happen. You can feel an amazing response right away, or it can take about a week for you to feel what you're going to feel. And over that course of that week, things are the number of neuronal connections decreases. And so you don't have as many nerves telling you that there's something wrong. Those are the two ways we think that this procedure helps with modulating the sympathetic response.
Interesting. It makes me think about, and we'll get into ketamine here in a moment, but anytime I've gone through a ketamine therapy session, whether it's, troche, lozenge, or IM, I haven't done any IV. I've always found that and a good ketamine therapist in a clinic will tell you this, be very mindful of your environment after the therapy. You're very susceptible to energy, to mood, to light, to stimuli. And so I've found that to be very true personally. Is that also the case here? If we go through this procedure, let's say, because I'm kind of in this different block situation, is my world radically different now? Am I more susceptible or less susceptible to things that could or would have normally kind of imprinted on me?
Yes, it kind of depends on the person, I think, on the patient. People that are more in tune with their body and their emotions are probably going to feel a rawness to it if they get a good response. A rawness to their environment that wasn't there. It's not the same as ketamine, where it's kind of you get a change in perspective that happens with ketamine. When you get the procedure done, it's that you're just more calm and more open to understanding what's happening or seeing what's happening. And that can, honestly, the amount of vulnerability that you can feel or rawness that you can feel varies person to person and block to block. So the overall answer is yes, be cognizant of what you're doing afterward. I tell people, stay off your phone. I don't want a text from a guy you don't want to hear from or a news story or something. Like I want today especially to be as emotionally vanilla as possible.
Okay.
Just hang out and chill. Whether you're going to extrapolate that same recommendation out to a week, that's usually a little big lift for most people. Got to go to work, got stuff to do. You know what I mean? But yeah, I mean, highest and best is just try to not have an emotional upset in that time period and be cognizant of what you're dealing with and the things that you're doing from an emotional standpoint. This
might be a stretch, but thinking in an ideal world for best imprint possibility and best long-term change for somebody. It makes me kind of laugh and think about, you've seen the movie Office Space. You know, the main character, he gets hypnotized into thinking, you know, his life isn't that stressful or his job isn't really that crazy. And he just kind of goes through life just so nonchalant. And in the movie, of course, it works to his benefit and he has a very chill, happy life. Is that kind of what we're talking about here? Are we kind of resetting the psyche in such a way that to really get the most benefit out of it, to be the most just centered to you and your experience and your processing, is there a preferred time frame of after a procedure like this, you know, we want you, you know, stay at home or off online, no TV, no work, you know, what, again, paint an ideal world scenario here to really maximize that imprint and integration period?
Yeah, I mean, when these are done at like retreats, for instance, that's the ideal situation where you're like away and you know you're already planned. Like everyone knows you're not accessible, you know, and then you can go in, you can be mindful about what you're eating, you can your sleep patterns, who you're talking to, what you're talking about, the environment that you're in. And again, like we see it out to our standard follow-up interval is a week out because it takes about a week for whatever's going to happen to declare itself. If you can do that for a week, great. Usually it's not approachable for most people because we do it in an outpatient setting. They come to the clinic, they go home. But yeah, ideally, just relax and try to get in touch with what you're feeling for a good 7 days afterward.
I understand also that this can be used for physical pain application, not just mental health pain or treatment-resistant mental health modalities. Is that correct?
Yeah, that's the traditional use for this.
Okay. How can something exist? How can the same procedure work for treating both physical pain and mental health pain?
Yeah, good question. So normally the nerves that carry pain information are pain nerves. Now, every part of your body has sympathetic nerves. Think about the ability to regulate how much blood is flowing to a certain organ or not. That's a sympathetic effect. And so let's say I have a problem with my arm. I break my arm here. When I first do it, my brain is going to hear about it through the pain nerves. If it's going on, if the pain is happening for over a month, then the sympathetic nerves that normally would handle blood flow and the amount of sweat on my skin in that area will start taking up the chorus and take that information to the brain. So now the brain is hearing the pain signal from both the pain nerves and the sympathetic nerves.
Wow.
So the procedure blocks that sympathetic inflow and makes it so that the brain no longer hears the pain signal in the sympathetic nerves. So that's why we can use both. And then also, I should finish that, this is also responsible for our fight or flight. And this is where the connection between, say, my arm in this case and the brain is, but it's also my connection between the rest of my body and the response, the physiological response that I have to stress in my brain. So that's why this is kind of the master key.
Okay, am I understanding correctly? Let's say, I'll use myself for example. I suffered some wild injuries to my back and my hips in service. And ever since then, I'm in a much better place physically, but I definitely still harbor some mental trauma around that to where I have hesitation with certain exercises or movements. And, you know, kind of the thoughts and fear of reliving that physical pain comes up again.
Yeah.
Is that because maybe, let's say if I had this procedure within, I think you said 3 months, you know, kind of the different nervous systems talking to each other there from a physical injury. If we had a procedure like this within a certain time period of a physical injury, are we cutting off the future potential for the mental and emotional pain side of our nervous systems to really begin to talk shop with the physical side? So could something like this really get ahead of mental health when we're dealing with a physical health pain origin?
Potentially. You know, when we're using this to treat physical pain, it's pretty common where we'll do a series because the one time doesn't take care of it entirely, and or there's still some kind of a healing process that's going on that's generating pain. So there actually is a problem. You need to know when there's a problem. That's what pain is for, right? But it's after the fact where the pain is now still coming up and it's already healed. That's when it's a problem. So I think what you're asking me is, let's say you have a traumatic thing that happens, you break your hip, you break your back. Do we treat the pain and preemptively do a stellate ganglion block on you? That's not an unreasonable thing. It's not done, and it's not something that we usually reach for, but it's an interesting thought.
Which kind of leads me to another question I had around this. What about poor physical health or injuries that drive someone to a poor mental health state? I used to be a clinical health coach, and I worked with people who really needed radical lifestyle behavior change, coupled with, or we're getting them off like medications. I worked with their provider, and then they would work with me on nutrition, exercise, and lifestyle behavior change. And so many of my patients, it would just be like, I don't know how I got here. I'm depressed, I'm anxious, I feel some kind of way, like I have body dysmorphia or even hatred or lack of ideal. I don't view myself in an ideal way like I used to. Right. Because of, I had children, or I was in a car accident, or I had an injury that next thing you know, 10 years later, that's still my excuse, valid or not, as to why I don't exercise, kind of thing. So many people can relate to this. They have a physical injury that turns into this poor mental health state. Should there be a difference in treatment when it comes to varying root causes of mental health? If it's you're in a poor mental health state because of poor physical health or acute injury, versus you witnessed a murder, or you were in war or something like that.
Yeah. Yes, it would make sense to try to treat the pain and the mental health problem with the same modalities if possible. Ketamine is another one. We use ketamine infusions, IV, to treat chronic pain as well. The dose is a little different. The infusion protocol is a little different, but there are those patients who have treatment-resistant depression, which is what we use ketamine for.
But doesn't that kind of make more sense because ketamine, first and foremost, is an anesthetic?
It depends on how much you give somebody, whether it's an anesthetic or not. It's an interesting medicine.
Yeah.
But does it make more sense to do that as compared to the stellate? Is that what you're asking me?
Yes.
Yeah. They're both used to treat pain. So maybe it seems more intuitive that you would do that, but I think it's reasonable to do the stellate ganglion block. Now, the stellate, when we're treating pain, it is used to treat the upper limb. So if I've got chronic pain in my arm, my right arm, I do a right-sided stellate ganglion block. If I have left arm pain, I do the left-sided stellate ganglion block because it's kind of cutting it off at the pass where it hits. Now, if I've got leg pain, there are similar procedures done in the low spine. So lumbar plexus block or lumbar sympathetic block can be used for somebody that has a leg pain or phantom limb pain. So it's not quite the same because if I'm treating PTSD, we found that it's in the neck that works the best. But let's say you have a back problem or you have a leg problem. I wouldn't use that same procedure to treat leg pain as I would for leg. But let's say most people get the most benefit from the right side of stellate ganglion block if we're treating PTSD. So if, luckily, we'll call it, it's the right arm that hurts, do it. Absolutely.
Man, it's like so many offshoots are coming to mind for this. But what about long-term benefits? You said you kind of go every 18 months. Have you found that just to be personally the sweet spot for you? Or what does the research or clinical evidence show us in terms of maintenance? Because I think in any modality, any therapy we're doing, especially when it comes to mental health, you can't just do X amount of ketamine sessions or X amount of therapy sessions and you're good for life. You need some kind of maintenance, whether it's in clinic or on your own.
Right.
Is there a sweet spot with stellate ganglion block for this? And then what about any negative side effects? Once we get a procedure, do we have to always get the procedure?
No, so it's different than ketamine in that with ketamine, we assume that you're going to need maintenance dosing. With a stellate ganglion block, we don't assume that. And there are plenty of people that have had a single procedure and are still doing fine. So we don't ever plan for a redoing of the procedure. It's more if you feel that the symptoms that we treated with the procedure are coming back, then come back and see us.
So it's more qualitatively based on if and when you get a re-up on this, not necessarily, you had X amount of trauma or X amount of mental health diagnoses, disorder or diagnoses, therefore you need X amount of follow-ups.
Correct. Yeah, it's a point in time. We call it a biological intervention for a mental health problem, and it will change the body. It changes the number of nerves. It changes the amount of norepinephrine, and it'll stay that way for most people. If you're in a safe place and you're not having trauma, especially if you had some kind of, the military is a great example. People that are no longer serving, they are not going to be exposed to some of the things that happen when the military, right? And if that's what it was, your traumatic event that gave you this problem, and you're not doing that anymore, you should be fine.
Should be.
You should be. But I mean,
but in any traumatic event, you change the environment long enough, like you should have some kind of, getting better effects.
Correct.
Yeah.
Yeah. So it really depends on the person. And when I'm talking to a person, this is not the first time I've been asked this question, but yeah, there's no protocol. You just know how to get a hold of me if you need me. I'm here, and we're all over the country. We can help you.
Do you ever worry that something like this, people might go, oh, 1 makes me feel great, 2 should feel even greater. I want this every month, every 6 months. Or is it do we become so in tune with our emotions and our healing process that it just becomes intuitive as to how much or how little we need? Do you ever worry about someone getting, quote, hooked on a treatment like this?
No. And the reason is, if you don't need it, you're not going to get anything out of it.
I see. So if you do feel like 1 was good, 2 or 3 might be great, and you go back, you're not going to get that same kind of effect.
Correct. And oftentimes I will tell people, if we're redoing your procedure, you're probably not going to get as much catharsis from a redo procedure. And the way I think about it is that, like, the first one took care of everything that was up to however old you were then. And then the second one kind of takes care of everything in the interim. So if it's been a year, it's just a year worth of trauma, just a year's worth of trauma, as compared to a lifetime's trauma before. It really depends, though, on how many symptoms the person is having in relationship to the trauma.
Okay.
So if they're feeling really, irritable, really on edge, really having disturbance of their sleep, intrusive thoughts, all the things that we see with that, if their symptoms are high, then they can still have that change back to whatever the lower level is.
Okay. Yeah. Again, speaking personally, I've been there once or twice, very early on in which I want to get into next, ketamine therapy. In my ketamine therapy sessions, I had such profound, immediate relief and benefits that I got so excited about, well, when can I do the next one? If that got me through this blockage, the next one's got to be even more. And true to ketamine, and I think other psychedelic modalities, especially, I found I got what I needed, not what I wanted in those instances. So definitely with ketamine therapy, there's a certain protocol, but then after that, you can go into maintenance. And I definitely found following those protocols and following that qualitative, intuitive maintenance worked better for me. But let me pass it back to you, talking about ketamine therapy, because I have heard also that this couples very well with the Stellate Ganglion Block. So maybe for someone, and I've talked a lot about ketamine therapy on the show, but high level, can you walk us through what is ketamine therapy and what is ketamine therapy as it relates to Stellate Ganglion Block therapy?
Sure. So the big 3 mental health problems that we have now is anxiety, depression, and PTSD. And Stellate, conceptually, when a person comes to us and says, I want help, we try to gauge how much of each of those things that person has. If your symptom complex is more toward the PTSD side of things, then usually we start with the Stellate Ganglion Block, because that will treat the biggest chunk of your problem or what you're feeling. Ketamine-assisted therapy it's really treating depression, treatment-resistant depression. Now, we know that there's overspray on anxiety, and that's true of the Stellate Ganglion Block as well. I tell people the Stellate does not treat depression. But if you're less anxious and the world's a less scary place, you may not be as depressed, because you may be able to get out and go do some things that can help with depression. Exercise, for instance. Get some sleep.
Would you go as far as saying that it's just like a downstream effect, not necessarily like a treatment for?
Correct. Yeah. Okay. I want to be very clear. I'm not treating depression when I'm doing the Stellate Ganglion Block. So that's also where ketamine kind of comes in, because ketamine treats depression. It treats anxiety, it treats PTSD as well, but really the thing that we're treating with ketamine is the depression. So if you do the two together, and they both affect anxiety, right? So then you're kind of getting all 3 of the things that most people are struggling with. Now, there could be personality disorder, there could be OCD, there could be other things in there. None of these help those things necessarily directly. Okay. So we looked at the numbers as far as response rates are as follows. With the Stellate Ganglion Block, up to 90% of people that have PTSD will get at least a 50% reduction in their symptoms.
Wow.
With ketamine, it's not quite as good. It's about 70%. We'll get about a 50% reduction of their symptoms or more.
Okay.
If you take the 2 together and you do them within a reasonable amount of time, you'll have, for both of those metrics, an additional 20% improvement for your PTSD on the one side and your depression on the other side.
That's incredible.
It's fantastic.
Yeah.
Now, the PTSD one is durable. The ketamine or the depression one needs the maintenance.
Okay.
But we know that. Like that's just the dance when you're doing this or that. But yeah, they work together very well. Is it because we're influencing neuroplasticity and trimming nerve levels? Yeah, probably. There's probably some interplay there. Ketamine, as you know, causes increased neuronal growth. Stellate, as I told you earlier, decreases the number of sympathetic nerve connections. So when I take ketamine, does that increase the number of sympathetic nerve connections? Yeah, it will in some way. It kind of does everything. It's more of a shotgun approach, right? So is it better to do the ketamine first and then do the stellate to trim up the bad growth of the sympathetics? Maybe.
Kind of like shines a bigger spotlight onto what you can go in and like trim. Like
well, it doesn't make it so I do anything differently, but we do know that ketamine makes more nerves grow or makes it the neuronal connections change.
Neural crosstalk.
Correct.
Right,
yeah. So that's one way of thinking about doing it. The other way is that most psychedelics or sedative hypnotics, when you first go in, if you have no experience, whether recreational or otherwise, it can kind of be confronting. And so if you're in this anxious space and then I give you a medicine that makes you feel less in control and your sensorium is altered and you're really getting spun up and anxious about that, so you can't drop into that, then it's probably better that I do a stellate ganglion block on you first.
I see.
So you can accept the ketamine experience in a more open way or whatever psychedelic you're doing. But getting back to the point, putting them together makes the things that we're treating respond better.
Is it the same? And most people, if you look up ketamine-assisted psychotherapy, the protocol typically is, I don't know if it's changed, 6 sessions. Six, it's like weekly, right? So is it still, if we're doing ketamine at all, alone and or with Stellate Ganglion Block, is it still the 6 sessions or is it a matter of, kind of, it depends?
So there's a protocol that we do that compresses them all into a short period of time, in which case we only do 4 ketamine sessions, so 2 stellate ganglion blocks if we need that, both one on one side and then on the other side, and then do 4 ketamine sessions. Most of the time when I'm doing a 6-session treatment course, the 4th one is the big one.
Why is that?
We're not sure. But if you ask any psychedelic or ketamine provider, or usually each one is different, as you know, and you may feel worse before you feel better in between these ketamine sessions. But usually the 4th one is kind of the tipping point where you're like, oh, okay, we're on the right track. The patient feels that, feels an improvement. So the short answer to your question is usually we'll do 4. Now, sometimes I will say, let's do them kind of serially over the course of a month or so. Like, let's start with the stellates first and see how you do with that. And then we'll do the ketamine after that if you still feel like the depressive symptoms are high enough or, that you need to treat that. That's a more measured approach. To do all of those in a week, that's a lot. So some people are fine with that.
It's a lot on your body and a lot on your life too. You gotta make time.
Yep. And integration is massive in there. Like,
crucial.
There's a lot of shifts that are happening. So some people want to know, like, did this intervention do this or did that one do that? Like, which one helped?
Yeah.
And so if you want that approach, or if you just don't want to get, the big hammer, if you will, if you want to like take your time and go through this because it's available, just wait, just come back and see us when you're ready for that. Then that's the more measured approach, and that's the one I usually tell people they should do. Some people are in a point where their life where they just want to do everything all at one time, and that's fine. But anyway, different ways of approaching it.
I'm so glad you bring that up because I actually had a question around this specifically. And, again, apologies if I'm kind of weaving in too much of my personal life here, but my audience knows, especially when it comes to this type of mental health treatment and just life experience, I've always been an open book, and especially on the podcast where I share personal experiences in my well-being. Be able to sit down across from an expert and a professional is just like the best personal continued therapy for me. So it's just as much for me as it is for my audience. So thank you guys for bearing with me. To paint briefly a picture of where I was when I first chose to go into ketamine-assisted psychotherapy, for lack of a better term, I was at my wit's end. And I think this is where a lot of people, specifically with ketamine therapy, it's for treatment-resisted mental health disorders or treatment-resistant therapy, where ketamine is supposed to be only after medication or only after traditional therapy, or only after all the work. And that was me, years of the work. I'd never been on any medication for it, but years of work, years on again, off again therapy. I need something. I need to go in the deep end because nothing else is really working. And my life is being stuck. I'm staying stuck because of this traumatic event. When your mental health goes unchecked or you're not getting results that you want for months or even years, you can become pretty desperate when looking for treatment options. And when we make choices with our life or our health from a slightly more fear-influenced place, one could argue that it might not always be the best rationale, even if it could be the best treatment for you. Would you agree?
Yeah, I mean, if you have limited options, you're going to choose less well, right? If you're in a spot where if you're desperate, I think that's pretty clear. If I'm not desperate and I can like think about things and have different weigh options, I'm in a better spot to make a decision. That's true of any kind of decision. But I guess where I would go with this is for the stellate ganglion block specifically, there's not a lot of downside to it. It is a medical procedure. There are some risks associated with it.
Like what?
So the things that can happen is if the medicine gets injected into the artery, there are arteries next to it, then you can have a seizure or you can have a thing where your heart beats erratically, which is dangerous.
Yeah, every time we talk about going into the neck, I immediately think carotid. It's like the main blood supply to the brain here.
Yeah.
We're good with that.
We are, because I do a lot of them. You got to know what you're doing. This isn't something just go and muck around in there. But with appropriate imaging guidance, I am a long way from anything that's going to be, the carotid specifically. I see it. I watch it. I can see the needle tip. When you're using ultrasound, it's like 0.2 of a millimeter accuracy as far as where you can put things. So I can get around or next to structures that are important that I not poke easily and confidently.
Thank you.
Yeah. So, there are some side effects associated with it as well, and we can talk about that. They're transient during the time the medicine's in there. But the point I'm getting at is ketamine is a little different because there can be some downsides to it. Not everyone responds really well to it. But when you're talking about the stellate ganglion block, it either helps you or it doesn't. It doesn't make it worse. It never makes it worse.
That I think is what I'm looking for. Yeah.
So I usually tell people it's a procedure that, should it be first line? I don't know. But it shouldn't be third line. It shouldn't be thought as being dramatic. Maybe that's because I'm comfortable with it. I do it. I've had it. I know what it is. If you find a provider that is also comfortable with it, or come see me, this is something we do safely. We do every day. Well, I do 70 of these a month. Not every day necessarily, but we do a lot of them. And we can help you feel better. Ketamine is also a good option, but again, it's not for everybody necessarily. So that's what I would say as far as, it's not answering your question directly, but.
It is for me personally. And so I think, I hope, and my audience is kind of getting that same response. We talked about a little bit of coupling ketamine therapy with the stellate ganglion block therapy and kind of it working synergistically together. But, one-off ketamine therapy, maybe walk us through that a little bit. What is ketamine therapy specifically? I know you work in IV drip therapy. Why that delivery approach? What can someone expect during ketamine therapy, particularly for depression and anxiety?
Sure. And we also offer the intranasal Spravato ketamine as well. The studies initially were done with intravenous ketamine. And then as you alluded to, intramuscular, in the muscle injections, troches, intranasal, there's different ways of getting it into the body. I think if you have the ability to either financially or otherwise do the IV, that's shown to have the best results from the scores that we use to look at depression standpoint. But it is kind of a song and dance to go in and get an IV placed and all the, have that all done. I'm a medical doctor, so I kind of like to stay on the safest side of things. We've had, even in the recent history, Matthew Perry, for instance, that things can happen that are not ideal. And so that's my bias. I'll be out there with that. Like, I like to have people in my clinic when they're getting it. Now the trochees are a little different.
Don't take ketamine and get in the hot tub.
Correct.
Or he was in the bath. Yeah.
Because it's not,
don't do that.
It wasn't a ketamine death. It was a drowning.
Yeah, exactly. Yeah.
Which is tragic.
Yeah.
But it also needs to be said, because there are plenty of people that are getting benefit from this medicine. So do it safely, however that looks for you. What to expect with it? Usually it's about a 2-hour, maybe a little longer experience where you're given a medicine and there's a dissociation between your mind and your body. That's kind of the point of it. And it can range from a light show to kind of just being black to kind of feeling out of it and light and floaty. It's not always fun. We talk about constructive suffering or productive suffering. Like, I know this is helping me. I have agency. I don't feel like I'm a cork on the ocean. It sucks. I've got to sit with this, but I know that I can get through it.
Like bad stress and eustress, good stress and bad stress kind of thing.
Good analogy.
Yeah.
So we can affect that, the way that a person is feeling as they're going through it, either by the dose or by coaching them. We don't do a lot of talking or reintegrating or whatever, like when a person's going through the ketamine session.
You don't do a psycholytic dosing, so there's no like coaching or therapy during that.
There are those that do that. We don't do that.
Okay.
If someone's having problems where they feel like it's too much, or, for whatever reason, need to help get redirected back onto whatever their stated intention for the session is, then we'll kind of go in and help de-escalate the situation and put them back in a better spot. Doesn't always work. Sometimes we just have to turn off the medicine. That's one of the benefits of IV. You can turn it off.
I was going to say, that's with IV. You can really control the dose. You can go more, you can less, you can stop pretty immediately.
It's not immediate, but it's like
a lot quicker than I am.
A lot. Well, yeah, I am. You're on the train.
Yeah.
You got to wait till your liver figures it out. It's not the
You're
medicine
buckled
train
onto
on.
that rocket for as long as it's up there.
Yeah. And also the way that it presents, the way that you feel it is different. The profile for the bioavailability with IM, you kind of get a big dose and then you come down like this. With IV,
that's why we do boosters a lot with IM, right?
Sure.
Yeah.
Yeah. So anyway, that's what you can expect. And then after you're done with it, once the medicine is out of your system and you're processing, it's sort of you come back to the point where you're feeling connected to your body, grounded in your body. Usually you're tired afterward. Most people are kind of happy and open. Not everybody, not every time, and it can vary, time to time. Sort of like breath work, sort of like isolation. It's like sometimes it's very much about the body. Sometimes it's very much about the mind, and then sometimes people can feel as though they leave their body. That can be that can be nice, that can be terrifying. We try not to make it so people go all the way to black where they feel like they're disconnected entirely. That can happen. Is the blackness kind and open and welcoming, or is it scary? This is something that
I was reborn in the blackness.
Were you?
I swear. I say all the time, and I'll link my other episodes about this, but in my first IM ketamine-assisted psychotherapy session, I think we worked up to, I think it was 75 milligrams. It was like 30 and then a booster after that. And in the blackness, complete dissociation, body separated from soul, complete ego death, reunited with lost loved ones kind of thing. And anytime I now go through a maintenance experience with ketamine, there are a lot of other benefits when I don't get that kind of same complete blackness, which air quote here, people might call the K-hole kind of thing, is like where I have the most therapeutic benefit. I come out feeling like my mental health is actually improved. I went in with an intention, met that intention, and in the darkness, was able to come out of it better versus other experiences where it's more that kind of flying through space, unique, euphoric kind of journey where it has like a lightning effect to my mood and to my body. And, I know that I'm getting the neuroplasticity and brain health benefits. So I kind of get a lot of it out of it no matter what. But yeah, I've only ever got the best benefits from the darkness.
Interesting.
Yeah.
And I wonder if that was, ketamine's very personal. And I'm not an expert in integration or reintegration with this. We've got a fantastic psychologist, Shauna Springer, that works with us. That's her thing, amongst other things. And so she would be the one to talk to about that specifically. But it's very personal, it's very impactful, and it's very common where you get a perspective shift. The way that I've described it, and this may be kind of ham-fisted, is I felt as though the idea of how important I was and how unimportant I was very clear to me. Yeah. I was completely unimportant, and I was very important at the same time. And that's what I took out of it. And to have to go back all the way to Black to see that, not really. I've heard, and I'm not good enough with meditation or breath work or whatever, but like I hear that psychedelics or sedative hypnotics are sort of a fast track to the place that you can get with meditation or breath work. And once you've had that fast track, you can find your way back through meditation.
Yes.
You probably are more savvy than I with this. Yeah. But it's that phase shift, that perspective shift is something that is, I know I'm not alone with. So that's completely different than the Stellate Ganglion Block. Okay. And another reason why I say this is not for everybody necessarily. But the first one, it's pretty approachable for most people.
Would you go as far as saying you would recommend ketamine therapy to the general public as a mental health tool, a regularity tool, like one would do for I journal every day, or I do breath work once a month, or I see a therapist once a week or once a month? Because I think that a lot of people, the more they can get ahead of mental health, like big T stuff, or you work on little T stuff before it comes big T stuff, it has profound benefits instead of waiting until, a year or 5 years later and all of a sudden you're going out of your mind or inexplicably anxious or depressed, or like you have triggers out of nowhere. And then you go back and then it's like, okay, now my life is a shit storm. I'm going to go back and retrace it to that event. Does ketamine therapy hold a place for maintenance, for just like we would go to the gym kind of thing, for our physical health, to our mental health?
Not a blanket recommendation, but sure as hell more than it is. There are some people with addictive personality specifically that can get kind of tied up in this stuff. And there are other sort of subsets of the population that I would say would be not be a good idea. But to have it as the second line, third line agent after failing. So let's use Spravato, for instance. Spravato is the intranasal form of this. It's made by a major manufacturer. It's covered by a lot of insurance. It's FDA approved. It's covered by insurance. And in order to get it paid for, you have to have failed 2 other antidepressants in the past. That's really all. And then have no reason to not give it, right? So should we put it behind 2 other antidepressants, or should we put it in front of it? Now that's a money question.
Yeah.
Right?
Yeah.
If it was me, and I was paying directly, or it was, let's just say it's free for everybody, would you put ketamine every so often in your body as compared to an SSRI or another antidepressant that doesn't do as good a work you take every day? It makes it so that you can't get sexually aroused. Like, not everybody, but there are some significant downsides to the others.
And it just comes down to adherence too, right? I mean, with medication, hell, with a supplement, or even just trying to eat healthily or exercise regularly, it's all about adherence for lasting change in your life. Having to take a medication every day has to have lower adherence than getting a ketamine therapy experience a couple times a year, maybe.
Totally.
Or even just once.
Yeah. And the other part of it, and we're not sure, it's hard to separate this, but let's say usually the places that have Spravato or have ketamine, they're kind of nice. Like you go in there, they treat you well, they know your name, they sit in this really comfy chair and put the eye mask on, listen to music. Like that's a pretty awesome experience.
I wanted to just stay there.
Totally.
It's such a vibe.
But then they're like, hey, Chase, we remember you. How's it going? XYZ. Like there's a connection, a human connection there. Oh, is that important? Yeah. So is that part of it? Probably. But who cares? Like that's the thing. I guess my point being is if you take a pill once a day at home, or you take a injection or whatever, however you take it, of ketamine every once in a while, and it gives you a better outcome.
Wow.
Why wouldn't you do that?
Yeah.
If it's the right medicine for you. I don't like it. Not for everybody, but for a lot of people, it's probably a better option.
It makes me think about, and as an MD, I'm sure you can relate to this, just the classic white coat syndrome. I'm sick, I have an illness or injury, and I go in to see my doctor, my provider, let's say a typical standard American clinic, It's, a horrible experience. The parking is ridiculous. It's a mess inside. Maybe I'm just talking about my own traumatic events at the VA system, but you don't know where you're going. You're getting shuffled through the system. You go see this person in a white coat. They've got maybe 11 minutes with you, and you get a medication. And like, there's such stress and anxiety built around that entire scenario that even though you're there for the right reason and getting hopefully the right medication, that environment can have potentially negative effects, even though the medication is right, even if it's the right medicine. Whereas what you're talking about is, what if we took away all of that? And what if, especially dealing with mental health here, you went to a place where you were actually looking forward to it? The parking was easy, the environment was warm and inviting, the people remembered your name. Whereas, again, speaking personally, I have to basically tell my entire life story to my provider, again, because he's overworked, or it's a new provider every 8-10 months kind of thing. Like, this stuff matters, does it not? Especially when we're dealing with mental health. And I think this is radically overlooked.
Yeah. And just speaking from all doctors, we wish it were different, honestly. But yes, to your point.
Or you are doing it different, so thank you.
Yeah. It's easier. And anyway, yes, you're welcome. But yeah, to your point, it's a nicer way to do it. It's a more effective way to do it. As long as the funding and the systems are there to support it for those that don't have access to a lot of money, then it makes sense for a lot of people. There's a lot of layers, but yeah, highest and best. Absolutely.
Yeah. That brings up a whole nother aspect. Not sure how far this rabbit hole we want to go, but speaking from personal experience, like my wife was a psychedelic nurse practitioner, and I happen to know firsthand the cost of a vial of IM ketamine compared to what most people are charging for it. And I understand, look, we're not at a place yet where this is just going to be readily available or prescribed, or that price cost has come down. It's a business, and it takes especially this kind of medicine, it takes a lot to get up and running, and it takes even more to stay, alive. So I get that, but cost is always going to be one of the biggest barriers to entry for people that need medicines the most, whether that's diabetics or just proper nutrition. It's access to care and cost. And when we're talking about mental health, the people that probably need this the most, I'm assuming, have less means or not as able to get this kind of care. Am I correct there? Or, what is being done about the people that need the most mental health treatment not being able to because of this barrier to entry being cost?
Yeah, that's hard. And is it that the people that need it the most are less likely or least likely to be able to get it? I don't know. I can't speak to that. I think that one of the reasons that, depends on how you feel, but no matter how you feel about big pharma, the fact that we have a insurance covered alternative now in the form of Spravato, that's the best answer to access to care that I've got for anybody at this point, assuming that it's covered by your insurance. And it's not every insurance, it's not every person, but the ability to get it into the bodies of a lot of people really often does come down to funding. And so, like you alluded to, the intramuscular, the intravenous, it is fairly expensive. And, for a lot of patients that we're seeing with the intranasal, it's like a $20 copay. So most people can not have Starbucks for 2 days and then
not
go
bad.
do that.
Not bad, yeah.
So yeah, that's a multi-layered question, and absolutely, it's a problem.
Yeah.
Unfortunately, that's the system that we're all living in. And again, from a doctor standpoint, we wish it were different. And some of us are trying, and some of us stopped trying and just found an alternative way. And that's a whole nother podcast. But
it is. But I would even challenge my audience member to go, if you are considering something like this, or any treatment, health therapy can be very expensive. Totally. It can be $50 an hour, it can be $500 an hour. Medications, you can have a $50 copay, or it can be $500 out of pocket. I would challenge us all to really rethink our approach to our preferred or proposed treatment plan, whatever that modality is, and whatever that medicine is, over a lifespan, hell, over a year or a couple of years. If you're on an SSRI, and I don't know what these cost these days, but let's just say, would you agree that if you're prescribed an SSRI or an antidepressant, you're on it for about how long? Like 10 years, a year's, your lifetime?
Yeah, I don't know the total duration on those. Usually it's a long time though. It's
Okay.
years.
Years. So
it's easily decades on a lot of people.
okay, so let's say what is decades of a $50 copay on a medication that you then, maybe you're staying here with, maybe it's working, but then also if you ever come off of it, it's a whole nother story.
Right.
What is that number? Now I know we're talking $50 now over a long period of time versus, maybe several hundreds or several thousands of dollars compounded now, but really radically revisit how much do you want to take your life back, and what are you willing to commit to maybe find different resources. Speaking from experience, the clinic that I went to is no longer around, but I went through a veteran program. And so, what benefits, maybe you're a first responder, maybe you're a nurse, maybe you're a military person, maybe you can find, I actually went through my first several rounds were a group. So maybe you can go through a group experience, typically have, reduced rates compared to a one-off. So I think first and foremost, our health and our life, if we commit to wanting to find a way to make it better, then we can find ways to make it better. We can find ways to get that work done. And it's just a matter of what are you willing to commit to how resourceful you want to be. Maybe how in the beginning, I forget your term, that getting necessarily uncomfortable, that you stress, good stress.
Right.
The constructive, what did you call it?
Constructive suffering.
Constructive suffering.
Yeah.
Here's an opportunity I would challenge everyone to dive into the constructive suffering, because it is a shorter lived suffering than what you most likely are going to be dealing with suffering for the rest of your life.
Yeah. Yeah, it's an interesting space because most people, when they have a mental health expert, they have a therapist and not necessarily a doctor, although you need a doctor to get an SSRI. But that's easy. If you just say, hey, doc, I'm depressed, they'll give you an SSRI. I guess where I'm going with this is you need to self-advocate, and you need to find the people that either provide this, or to your point earlier, is there funding available? If you are part of some sort of subset of the population that has foundations that are directed at what you did in your past life or whatever, that's a good place to start too, and look around for funding. Sometimes if you go to a clinic that does this type of work, relationships have been forged, that will help with that type of thing. But that's always in flux. We work with a lot at Stella. We work with a lot of different foundations, whether it's military or first responder, or there's others even. There's some employers that are offering this as a benefit for their employee.
Oh, no way. Wow.
Yeah,
wow.
which is very, has a lot of foresight.
Amazing.
There. Yeah. So, but you got to start asking the questions first. And I'm sure your listeners are good at that with just, the subject matter that you're looking at, but you got to be an advocate for yourself, because it's not going to come from a doc who wishes it was different, but they only have 6 minutes with you, or a therapist that doesn't really understand it and doesn't know where to send you, right? Like, let's say I want XYZ. They're like, I have no idea. I just have a practice here and I do what I do, but I don't know how to get you into that.
Not good enough.
There's a lot of siloing in mental health, in healthcare in general, meaning like one part of it doesn't talk to another. And the only constant is going to be you as the patient, and figuring out what's right for you, or at least what you think is right for you. You may not be right, but at least start asking the questions.
The life we want, and kind of getting towards the end here, perfect segue of, the whole premise of the show, living a life ever forward. The life we want is, I believe, fully dependent on the quality of the questions we are willing to ask and the commitment to the work necessary to that life. When you ask questions, or you're getting, even if you're not asking a question, you're just getting an answer, especially when it comes to your well-being, your physical, mental, emotional, spiritual well-being. I feel like, and not talking about you, present company excluded, so much of the current healthcare system is we are getting fed answers before we ever even ask any, or much less the appropriate question. And is that the education system? Is that culture? Is that, upbringing? Is that just the system in general? Maybe a lot of it has to do with that. But we're at a place now where we don't have to accept that. I choose not to believe that we have to accept that anymore. And I, again, speaking from experience, know that change is possible. Healing is possible. First and foremost, hope is fucking possible only by choosing to ask different questions and consistently putting in different work. I firmly believe I would not be here if it were not for that mindset and for this kind of like treatment we're talking about. Gets me all up in my feels. But
Yeah, I love it.
It's so true. It's so true. Well, Dr. John, this has been incredible. It's very eye-opening for me. I'm very excited to dive deeper into and potentially even going through this experience myself. My last question before my last question is kind of really to bring it home to what we were just talking about. Is the public really ready for treatment like this? And beyond that, I think what keeps a lot of people from living a life ever forward and changing their life is not because they don't think it's possible, but the fear of what their life is going to look like when change happens. What is my life going to look like? How am I going to feel when I don't feel depressed? Or when I have hope that separating more from my depression and anxiety and PTSD is possible. I'm living, breathing proof that it's possible. There's a fear associated to actually achieving our goals and achieving the life that we want.
Sure.
Are we ready for this? Is there a promise of longevity for something like this for us right now in America?
Yeah, I mean, like you said, you got to want it. You got to lean into it. You got to ask the right questions. There are going to be those that are not ready, but are we as a society ready? Yeah. People are already doing it. You know, the fact that I do this as much as I do tells you that there are people that are going through this and getting good results and coming out this other side feeling great. So yeah, is society ready? Yeah, absolutely. In fact, they're beyond ready. They're tired of feeling bad.
Oh, yes. Yeah, I think we're really at a tipping point. We're sick and tired of being sick and tired.
Yeah, well said.
Ever forward, those two words, what do they mean to you?
I think the thing that came to mind when you asked me that is growth is not usually linear. Meaning you kind of have to go back to go forward sometimes. Go in the direction you're pointed, even if it seems like you're going the wrong way, because it probably is just for a short time. Keep asking the questions, how can I get to where I'm wanting to go? And be generous with yourself if you're not where you think you should be. Show up when you can. Show up more than you don't. And just know that it's not going to be easy and it's not going to go like you think it should, but it's still going to be okay.
I always appreciate every answer. There's never a right or a wrong one. So thank you for your interpretation.